Integrative medicine Dr. Jeff Glad is here to talk about living and eating healthy. And doctor, it's good to see you.
Good to see you.
It's Wednesday, that means you must be here. We were just talking in the break a little bit about babies. I saw my friend who has twins, really young twins, and one of them is really colicky. I saw them over the weekend. But you had some interesting suggestions that I might not have thought of, and I don't think she's thought of either.
Yeah, I think there's a lot of things to do for colic that work quite well. From a medicine perspective, we don't know what causes it. We don't really have any clue what the driving force is, and so we try different medications here or there. But and it really is a big burden on parenting. I mean, to try to raise a colicky child is very, very difficult. Especially when you're just transitioning, as a new parent, or even if you've had a couple kids and you're trying to work with them too. Gluten and dairy, or dairy particularly, can be an issue for these kids. So if moms are breastfeeding, we try to get them off of dairy, get them off of gluten, get them off of soy, and have a cleaner diet that may not be as irritating to the baby. If they're using formula, we try to switch them to one of the elemental formulas, like a Nutramigen, to kind of be free of those things to see if that helps. Chamomile tea, actually, small amounts of cooled chamomile tea can help with their soothing effect on the digestive system, can be beneficial. And then there's some really good care things as far as swaddling them, rocking them, creating some noises to kind of, one of the theories is that, the baby wasn't ready to come out of the womb, and so you try to create the womb.
Oh.
Dr. Harvey Karp, K-A-R-P, did a lot of that work and has a great DVD and book on how to help babies with colic. And I know we used that for one of our children, and it was pretty amazing in how it helped soothe them. So
really?
You can find his DVDs on Amazon or just search Google for Dr. Harvey Karp. But there's a lot of great tools, and having those are good to implement, to help the parent kind of maintain some control of the situation.
Because the constant crying, really, you can understand how that's such a stressor for parents.
I mean, it's a stressor, it's a heartbreaker, because the baby can't tell you what's wrong,
right.
So you really feel kind of hamstrung. So having some of these techniques and tools gives you some empowerment, like we talk about in adults. It empowers the parents to be able to have some tools to help their babies.